So you have Crohn's disease and you're wondering whether your therapy is effective or whether you should be on something else or whether you can just stop it altogether. And there's a group at the University of California at San Diego who are very interested in trying to answer this question and the role of using endoscopy to help guide therapy. They've previously published on ulcerative colitis, and now, just recently, they published their experience with Crohn's disease. And it turns out that treating to getting your intestine to be healed is the most effective way of actually getting patients in remission and feeling the best that they possibly can. So what does that mean? So if you are on a biologic and you are still having diarrhea, you are still having abdominal pain or unable to gain weight, but otherwise you feel pretty good and you just have a single symptom, that it might be that looking at your tissue with a scope is the best way to know whether your therapy is actually doing the most it can for you, and that with all of the biologics that we can certainly check levels in your blood and we can increase the doses so that the target now is to actually heal the tissue, which we never thought we could do before, and that the presence of any inflammation and ulcers may be what's contributing to continued symptoms, and that the goal now is to actually treat to healing. And while we've shown this to be effective in ulcerative colitis, it appears the same thing is true for Crohn's disease as well. So the expectation now is that you can actually heal the tissue. And if your tissue is not healed and you continue to have ulcerations, that perhaps this medicine isn't the right one for you, or that you're not on the right dose. So as uncomfortable as it may be to undergo colonoscopies, that they really can be very helpful in actually helping with the short-term and long-term natural history and treatment of your disease.